Management of transverse malocclusion, crossbite. In normal occlusion, the transverse relationship includes the transverse relationship of the posterior mandibular teeth to the maxillary posterior teeth. In normal occlusion, the mandibular posterior teeth, the buccal cusp, occlude to the lingual slope of the maxillary posterior teeth. So the crossbite represents any discrepancy or deviation in the buccal-lingual relationship of the lower teeth to the upper teeth. Discrepancy, it is important to diagnose the normal mandibular function or abnormality in the mandibular function. In general, the centric relationship, which is the relationship between the mandible to the maxilla, or what is called the retruded contact position, or the relationship of the mandible to the maxilla when the condylar head in the most posterior and superior position should be coincident with centric occlusion. But when there is incisor or occlusal interference, the mandible may be displaced laterally during the path of closure, and when the mandible is displaced laterally, it causes what is called here the posterior cross bite, because the occlusal interference enforces the mandible to deviate or shift or displace laterally and cause a cross bite. In addition, during the normal closure of the mandible, as here, when there is no occlusal interference posteriorly or anteriorly, the mandible will occlude normally and the centric relationship is coincide with the centric occlusion. But when there is anterior interference, occlusal interference between the mandibular and maxillary teeth, the mandible will be enforced to displace or shift anteriorly and cause what is called anterior cross bite. As in this case, the child have an edge-to-edge interference between the mandibular and maxillary teeth and cause the mandible to shift anteriorly and cause what is called anterior crossbite or pseudo class 3. Classification of crossbite is according to the etiological factor either of dental origin or skeletal origin. The classification of crossbite according to the position either anterior crossbite, which include either crossbite of one tooth or involve more than one incisor tooth anteriorly. The crossbite also classified to the posterior crossbite, which include the crossbite of the posterior teeth, either unilateral or one side of the posterior teeth or both sides of the posterior teeth, and in this case is called bilateral posterior crossbite. Crossbite also classified according to the extent of the posterior teeth into lingual crossbite, where the buccal cusp of the posterior teeth, mandibular posterior teeth, occlude lingually to the lingual cusp of the maxillary posterior teeth. And when there is bilateral lingual crossbite is also called a scissor bite. When the posterior mandibular posterior teeth occlude buccally to the buccal cusp of the maxillary posterior teeth and involve the bilateral side or both sides of the arch is called bilateral buccal crossbite. When the buccal crossbite involves one side only, as in this case, it's regarded as or called a unilateral buccal crossbite. When the unilateral buccal crossbite not associated with the lateral mandibular shift or not associated with lateral mandibular displacement is called a true unilateral buccal crossbite. The crossbite, when occurred in conjunction or the lateral mandibular displacement due to the occlusal interference occur or the posterior premature contact between the cusp of the posterior teeth that cause deviation or displacement of the mandible. In this case, the crossbite is called false unilateral buccal crossbite. It's important to differentiate between the true and false unilateral buccal crossbite because during the treatment, the true unilateral buccal crossbite not need for any treatment because it not affect on the function of the mandible or not cause any displacement of the mandible laterally, and at the same time, if the posterior unilateral buccal crossbite, the true one, is aesthetically acceptable, it not need for treatment. Otherwise, when the unilateral buccal crossbite associated with the mandibular displacement laterally, which is called the false unilateral buccal crossbite, in this case need for treatment because the false unilateral buccal crossbite cause deviation of the mandible and affect on the symmetry of the face. The treatment of crossbite, either anterior crossbite or posterior crossbite. In general, the anterior crossbite is need an early treatment as possible because the presence of the anterior crossbite cause mandibular displacement, and the mandibular displacement, whether it is lateral or anterior, may cause facial asymmetry because effect on the growth of the mandible, and at the same time cross gingival recession of the mandibular teeth. The appliance used in the correction of the anterior crossbite mostly is the removable orthodontic appliance, and when the treatment or the movement of the teeth that need for the correction of the anterior crossbite is tipping movement, we preferred the removable orthodontic appliance. In the removable orthodontic appliance, we need for a good anterior retention because the active component may cause displacement of the appliance. In addition, the removable orthodontic appliance in the correction of the anterior crossbite should incorporate a posterior bite plate, and the posterior bite plate have a benefit to free of occlusion anteriorly to give a good space for the tipping or the buccal labial tipping of the anterior teeth to the correct of the anterior crossbite. The active component that used in the treatment of the anterior crossbite, either the Z severing in case of the single tooth or recurrent Z severing when you have a more than one tooth involved, or a screw. It's important after the correction of crossbite you have a sufficient overbite to prevent the relapse of the incisor here to the crossbite position. When you don't have sufficient overbite, you may need for a fixed orthodontic appliance to correct the anterior crossbite. The fixed orthodontic appliance for the correction of the anterior crossbite is for correction of the blocked out lateral, as in this case, and the creation of a space for the crossbite lateral is a part of the comprehensive orthodontic treatment for the correction of the crowding in this case. Sometimes the extraction of the completely blocked out lateral incisor is an option for the treatment of anterior crossbite when the lateral crossbite not affect on the occlusion or the function or the aesthetic of the patient. The posterior crossbite is corrected by use of expanders. The expanders that used in the correction crossbite mostly classified either into slow expanders or rapid expanders. The difference between the slow expanders and the rapid expanders is the age of the patient. When the patient is younger in age or pre-adolescent age, we prefer to use a slow expander as a coffin spring. The coffin spring is an omega-shaped spring of hard stainless steel wire incorporated into the acrylic base plate, which split in two parts and cause on removable orthodontic appliance and cause slow expansion of the arch in child in mixed dentition stage and pre-adolescent child. The same spring or expander or other expander is the quad helix appliance. The quad helix appliance is regarded as slow expander that fixed orthodontic appliance soldered to two band and incorporate a four helix, so it is called a quad helix expander. The quad helix expander and coffin spring are cause slow expansion of the arch in children because the mid-palatal suture is weak and easy to expand it. But in adult patient or patient with over 15 years old, the mid-palatal suture is difficult to expand it, and in this case we need for a rapid expander such as the Hyrax screw, which cause expansion of the whole palate by the rapid expansion in 2 days. Also, the difference between the slow expander and rapid expander is in the origin of the crossbite. Mostly the crossbite due to the dental etiology or the dental causes, we use coffin or quad helix appliance, while in crossbite due to skeletal origin or skeletal crossbite, we prefer the use of the Hyrax or rapid maxillary expander. Also, the fixed appliance with the cross elastic between the lingual aspect of the maxillary teeth to the buccal aspect of the mandibular teeth to correct the crossbite by buccal expansion of the maxillary teeth and lingually constriction of the mandibular teeth correct the crossbite posteriorly. Thank you.